In this video, I will be describing a cone beam CAT scan guided dental implant procedure for the replacement of all of the upper teeth. This is a major advancement in implant dentistry. By using three-dimensional imaging of the jaw, we can ensure the most ideal implant position for each implant. The result is the ability to more exactly place temporary teeth the same day, stronger and healthier implants with a more aesthetic result and an easier process for the patient. This is a case Dr. Gradwell and I worked on together, and Dr. Gradwell places the implants. Me, as a restorative dentist, it's my job to create the teeth that are placed at the time of implant placement. Those are temporary teeth, and then the final teeth at the end of the process. The beauty of this is that I can walk us through the process of how guided implant surgery works based on the model created, because that is the exact same implant position and protocol that's used the day of implant placement on the patient. So what we're seeing right off the bat is similar looking models. This is the traditional model we would have planned a case with, stone model, but the CAT scan derived model is created in slices, so we can remove the teeth, which are relevant to us planning the implants, the gum, which again is secondary to the bone. It's important to know how much bone we have, and sometimes it's deceiving, especially looking at a traditional model, actually how much bone is there versus gum. But with the CAT scan, we can remove that. We can remove the teeth. We're removing the gum. Now, this is the actual model of the bone that we have to work with. After some of the superficial and weaker bone is out of the way, we can see exactly what we have and where the best bone is. Now I'll be putting up an image of the actual cone beam, which shows cross sections of the bone, the density of the bone, also the implants superimposed on the CAT scan, and from that, and that's a separate session that we go through in the planning stage, and then this is created, and from this we can move ahead, and I can show you some of the steps that are involved. And really, what's most interesting here and important is just the precision, the extreme amount of precision that we're able to place these implants, and that's very important for the strength, the success of the case, aesthetics, just ideal location. It predicts the parts that we're going to need, and it also ensures that the temporary, like I said before, is very, very accurate with minimal adjustment necessary. This is the implant guide or implant stent. It fits perfectly in the mouth, and it guarantees that the ideal implant position determined on the model gets transferred perfectly to the mouth by the implants getting placed through each guide hole in the stent. This picture shows the abutments on the model, and as I said before, that's identical to what is seen in the patient at the time of implant placement. And like everything else, those abutments have been predetermined, the angle, the size, the dimension, to line up with the eventual teeth to get the most perfect result. This picture shows how well the temporary teeth line up with the abutments on the model, so that when it's time to refine that temporary in the patient's mouth. Everything moves ahead very smoothly. There is a guide that secures the teeth, which we see here, to the correct position of the cylinders. And once that's locked in place in the patient's mouth, then we fill these holes with an acrylic that secures the teeth to the cylinders to the implants. For this to line up so exactly and perfectly, it really is a testament to the process and how exact it is, and how much better we can do. It really is a game changer, because having done this now for 20 years myself, attaching teeth to implants at the time of the placement of the dental implants, without this level of precision and planning, it was a long, somewhat inexact procedure where we would have to make adjustments on the fly, change parts out. It would be a very long visit for the patient, and the end result, which people were thrilled with, but just in terms of precision, quality, it's beyond compare. It's just phenomenal, and this part of the video shows that, because this was done in the patient's mouth using the guides, and now I can put this back on the model used to fabricate the guides and confirm just how perfect that all ended up being. This picture shows temporaries in place a few weeks after placement of the implants, as well as the temporary teeth. And you can see how natural of an appearance we were able to accomplish. And it also gives him the ability to sort of test drive the teeth, make sure he's chewing comfortably, speaking well, likes the appearance, the shade of the teeth, all those things that we can transfer to the final teeth when it comes time for them to be made.